Utah Business and Roseman University of Health Sciences are proud to present the 2023 Healthcare Heroes, recognizing excellence, innovation, and achievement for healthcare professionals in Utah. Today's event is sponsored by Roseman University of Health Sciences, CHG Healthcare, Webb, Biomeria, Eliana White Consulting, Little America Hotel, Marathon Health, Norda College of Osteopathic Medicine, Optum Healthcare, Real U Plastic Surgery and Wellness, Regents Blue Cross Blue Shield, Rocky Mountain University, and Select Health. And now, please welcome your Master of Ceremonies, weekend anchor with KUTV2 News, Mallory Moore.
Good afternoon, everyone. We have quite the crowd here, a big group. We're excited that you could join us this afternoon. On behalf of Utah Business and Roseman University of Health Sciences, I'm pleased to welcome you to this special event where we spotlight and honor the healthcare heroes in our community. Those working in the healthcare arena, they serve in a variety of roles, from administrator to physician, educator, nurse, innovator, but they all share one thing: a dedication to healing and a commitment to improving the quality of life for their patients. From newborns to accident-prone teenagers, and from adults working to improve their health to those facing a really serious illness, healthcare heroes touch all of us in some way. Each of the heroes that we are celebrating today have shown a special passion for healthcare, and we appreciate all that you have done. So congratulations to all of you for doing what you do, working long hours, saving and improving lives, and putting others' needs ahead of your own. Your work, especially here in Utah, and especially over the past several years, is invaluable, and we thank you for it. All right, I want to give you a little background on Utah Business. Utah Business fosters connection, insight, and recognition for Utah's thriving professional community. Through their events, magazine, their website, they highlight the ideas, the innovations, and especially the people behind Utah Business success stories. They are all in on Utah and can't wait to tell your stories. Please welcome Utah Business's Editorial Advisory Board member, Steve Carlisle.
Welcome, and thank you for joining us today. I'm going to be brief. I'll take just a few moments, but upfront warning, this is your chance to really get through most of your lunch while I give my remarks, because after me is going to be the exciting part where we're going to be honoring all of our honorees this year. But we thank you for joining us today. As mentioned, my name is Steve Carlisle. I serve on the Utah Business Advisory Board, and I'm excited to be here with you today. It's a delight as we honor and spotlight the remarkable stories and incredible achievements of this year's healthcare heroes right here in our beautiful state of Utah. Before we proceed, I want to express my gratitude to Mallory Moore from KUTV2 News for being here to help us recognize our honorees. And I also want to extend our sincere appreciation to Roseman University of Health Sciences, our presenting sponsor for today's luncheon. Alongside them, we have our premier sponsors, CHG Healthcare and Webb. I also want to acknowledge our primary sponsors, all of whom have played an instrumental role in making today's event a resounding success. Their unwavering support is truly appreciated. Now, as we gather, it's important to remember that healthcare encompasses a multitude of specialties. Yet, all healthcare practitioners share a common thread. They refer to their work as practice. With the ever-advancing landscape of technology, the emergence of new diseases, and our ever-evolving understanding of the human body, healthcare itself is continuously evolving. Clinicians embrace each day as an opportunity to practice their art, solving new puzzles and growing in empathy for their communities. The renowned author Joseph Campbell once said, "A hero is someone who has given his or her life to something bigger than oneself." And that, my friends, is exactly what our healthcare workers do each day. They dedicate themselves to something far greater than themselves, something that touches the lives of countless others. So it's an honor to recognize these extraordinary professionals who are driving healthcare forward in our state. Over the next hour, you'll be captivated by the inspiring stories of our honorees. Take, for instance, BYU's very own Dr. Julianne Holtz-Lundstad, the founding scientific chair and board member of the U.S. Foundation for Social Connection, and also the Global Initiative on Loneliness and Connection. Her research, which has been cited over 22,000 times, has made a profound impact. She serves as the lead scientific editor for the U.S. Surgeon General's Advisory and National Strategy, and she has even provided expert testimony at U.S. congressional hearings. Then there's Dr. John Doherty, a true innovator who has revolutionized medical education at Nordic College of Osteopathic Medicine by creating a new curricular model. This model combines recorded lectures, technology-driven lab experiences, simulated training, and frequent research opportunities, better preparing students to excel in clinical work. We also have our other heroes like Kathy Higbee, the sexual assault nurse examiner coordinator at Cache Valley Hospital in Logan. Kathy provides not just medical care, but also a safe haven during her patients' most vulnerable moments, showcasing incredible compassion and dedication. These are just a few glimpses into the remarkable stories of our 2023 honorees. We're truly excited to share more about each of them and all they have accomplished today. Thank you all for being with us, and without further ado, let's embark on this inspiring journey together as we honor our healthcare heroes. Thank you very much.
Roseman University of Health Sciences is a private nonprofit institution with campuses here in South Jordan, Utah, as well as Henderson and Summerlin, Nevada. Roseman is training the next generation of competent, compassionate healthcare providers in nursing, pharmacy, dentistry, and graduate studies, as well as providing high-quality, affordable dental care to underinsured and the uninsured Utah families. Roseman University is transforming education, reimagining healthcare, and embracing discovery while also committed to our community. Please welcome from Roseman University of Health Sciences, South Jordan Campus Chancellor, Jeremy Wells.
Thank you, and good afternoon. We are thrilled as an institution of higher education to support this great effort in recognizing our healthcare heroes. Roseman University is this gem of a university located in South Jordan. We may be relatively small, but we certainly believe in contributing to our community in big ways. As an example, our College of Dental Medicine typically gives about $1 million in uncompensated dental care a year. We provide free, comprehensive dental care to participating refugees. We also provide care to veterans and to those who are underinsured or not insured. We understand that though we may be small, we can do great things. And I believe that is in part of what this recognition to all of our Healthcare Heroes Award is about as well. You as individuals, if you're passionate and work hard and care, can do so much good in our communities. We're thrilled to be a sponsor of this event. We believe in what we're doing here and recognizing you. We're so grateful to be able to rub shoulders with you. We're so impressed and inspired by what you have done, and we look forward to seeing all that you can do in the future. So again, this is a thrilling moment for us to be a sponsor of this event, and again, we feel it a great privilege to meet these awardees and again to rub shoulders with them. Last week we met with them, many of them, at a VIP reception at our campus. and got to know them and their families and their colleagues, and they're all exceptional people. So thank you.
We now want to move to the award part of this afternoon's program. We want to first recognize the honorees in the Administrative Excellence category. Please turn your attention to the video screens to learn more about these individuals that play a special role in the behind the scenes of the healthcare industry.
This project helped parents of minorities to get resources for their children to study health careers. We thought there was a gap between parents and schools. Sometimes minority parents don't like to go to schools because they feel like they are comfortable going to their meetings. So we decided to create this program to provide all the information they need to encourage their children to study health careers. It's my passion to work with people, to help people. Before I worked with domestic violence, sexual assault, and human trafficking, and it was amazing all what I accomplished working in that field, and I wanted to continue helping people, and this opportunity came through the University of Utah, and I love the program that we're working with. Usually they think that healthcare is medicine, nursing, and very long careers that are super expensive. And we provide them information about hundreds of careers related to health that they can do between 6 months and 10 years, like medicine. They can continue little by little, and they can make it because they can apply for so many scholarships. They can apply for financial assistance. They can apply also for scholarships that are available and they don't know where to go. So it has been great to helping them with that.
Accepting the award on behalf of Maria Isabel Gomez, please welcome Tatiana Allen Webb with the University of Utah, Utah AHEC.
My mom will tell you since I was little, every time someone asked me, I said, I'm going to be a nurse. And I grew up and did it. But I love helping people, and I love being in a position where what I do makes a difference, not just for the patients, but for the staff, and I can help improve outcomes. Well, I started as a med-surg nurse, as many nurses do, and I realized as I tried all these different areas of nursing that I had a passion for critical care. So that really held my heart for many, many years, and I stayed in that. And then I progressed to being the director of the critical care for the hospital I work at. And then after about 5 years, I moved on, and I am now the assistant chief nursing officer, and I just feel like I've been given opportunities in my career. I've been very fortunate to have to learn and to grow, and then be able to help those and serve the staff. So throughout my time in critical care, I have been a part of the process of providing higher acuity treatments. Some of those which were really beneficial during COVID were life-saving treatments that helped people be able to survive long enough to beat the virus, and so I'm really proud of that. And then most recently, I had my own personal health scare and an experience that led me to work with the doctors that helped save my life to improve pulmonary embolism care for the hospital. And so I would say that's recently the thing I'm most proud of, is to know that patients after me will receive timely care and have a better chance for survival.
Please welcome to the stage from St. Mark's Hospital, their Assistant Chief Nursing Officer, Jennifer Jellerson.
licensed clinical social worker, and I work in maternal mental health, and I have for the last about 7 years. And it became really important to me after I had my second baby, and I was working at a local hospital and got the opportunity to see moms come in and have issues with depression and anxiety, and a lot of times we just didn't know how to manage it and handle it. And so I wanted to create something that would be just for moms. They could come and they could get really good care and knew that we cared about them. We have a beautiful space that offers childcare, and we have multiple therapists that are all trained in perinatal mental health and are a lovely staff. I think where I feel most accomplished is that we are doing something that matters. Just creating a safe space for them. I still meet with the moms, and I'm still very much in the day-to-day, and I feel honored to be next to them. So that's the biggest accomplishment.
Please give a round of applause for the owner and clinical director of Serenity Recovery and Wellness, Lindsay Proctor.
Primary Children's just celebrated its 100th anniversary. So it was a great time to talk about the history. And one of the important pieces of the history was pennies by the inch. And this is an actual bank from the hospital in the 1950s where children used to collect their pennies. So when children would go to primary, which is the school for the Church of Jesus Christ of Latter-day Saints, they would drop their pennies in this box and they do a penny per inch of their heights. And that was one of the really important early fundraising projects for Primary Children's Hospital. And philanthropies continue through today. There's absolutely fabulous generosity from our community. And in fact, we are engaged right now in Primary Promise. I have my Primary Promise scrubs on. And it is the most significant philanthropic effort for children in this generation and serves the entire Intermountain West. You know, my mother was a nurse, and so that gave me a great interest in healthcare, and I knew I always wanted to give back. And so being a nurse was a wonderful way of doing that. So it's really interesting as you progress through your career, the parts of your job you like the best change. So when I was a nurse at the bedside, I loved the relationship with family members. And now it's representing the incredible work of other people and thinking about how do you make sure you leave the future a much better place than today.
Let's give a big congratulations to Katie Welke, Vice President of Intermountain Children's Health and Chief Executive Officer of Primary Children's Hospital. All right, we want to learn a little bit more about the individuals who are involved with community outreach. So please turn your attention to the video screens.
I think the reason that I've pursued healthcare from the very beginning has just been to make a mark in the world, to make a difference in the world. My very first position out of high school was with a foundation that raised money for lung cancer. It was something I wanted to do right away. And my husband and I have lived in many states over the last many years, and it's always been healthcare, 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 then Intermountain Health. I'm the strategy manager for a department called Care Traffic Control. cute, yes. We are care traffic controllers. We coordinate care throughout a very complex health system. Patients don't always know exactly where to go next, and it makes a big difference to have somebody that is dedicated just to you and help you navigate whatever's happening. And it can be as simple as cancer screening, and it can be as complex as multiple chronic conditions and trying to navigate all of the physicians that are involved in that. My primary role is to develop the care coordinator position so that it can branch out into more and more fields of medicine, branch out into more and more methods for helping patients. It's just not always easy to care for yourself, so we're the ones that help navigate that for you.
Please welcome Mel Hamer, Care Coordination Strategy Manager with Castell, an Intermountain Health Care company.
RAMP does 4 different things, and the first thing is it's connecting peer mentor to current patient. So someone who's already had lived experience with someone that's just recently going through it. And that's the first and most important part. The second part is we do a lot of mindset training and helping people to really understand that there is life after trauma, that they can rebuild, that they can live a healthy, fulfilling life, whether that's in a wheelchair, whether that's with one arm, whether that's with a missing leg. And so we do a lot of that coaching, if you will. And then the third part is we do a lot of adaptive sports, and we take people out and teach them how to bike again or ski again, or maybe for the first time, and just to show them in the community. So we're not just talk, we're actually doing with them, and we're inviting people in the community to tap into the resources that we have here. We have incredible resources for adaptive sports, and so that's a big part of what we do, and that's a lot of fun. And then the fourth part is helping people to just build a community. So if you experienced trauma and you have a spinal cord injury, you get to be the expert in that and in your lived experience. And in that way, you're a leader. And then we're building a community of resilient individuals, which is, I love that.
Please welcome to the stage occupational therapist and founder of Rehab Advocates Mindset Mentorship Program with Intermountain Health, Bonnie Larson.
One of the programs that we are doing at Roseman is called Give New Utahns a Smile. And this is an opportunity for us to invite the refugee population that are living here in the state of Utah to come to Roseman Dental School and receive free dental work. There are about 60,000 refugees here in the state of Utah from all over the world, and most of them have never been to the dentist before. And coming here to the state of Utah, desiring to set down some roots, get jobs, get an education, it's really important that they have good oral health. Helping them to do that by providing this service for them is a wonderful thing. We have about 150 refugees that come to Roseman on this Give New Utahns a Smile Day. And on that day, they come in and we get as much dental work done for them as we possibly can, so that they can go forward with their lives and be productive citizens within our community. They're very thrilled about what we provide for them. For example, an individual, a lady from Afghanistan, came to our school during this program, and at the end of the event she got in the car and drove home with the family that was hosting her, and she couldn't stop looking in the mirror and saying, "Wow, what a beautiful smile I have."
Congratulations to the Director of Public Health Sciences and Associate Professor from Roseman University College of Dental Medicine, Ryan Moffitt.
I'm a native Hawaiian woman. We experience a lot of health disparities in our Pacific Island community. A lot of it is historic. So growing up on that knowledge, I worked through mental and behavioral health care, and I found my way to public health by chance during COVID. And I do a really good job, apparently. People like my work, and so I've really found a place there. And it reminds me of the devotion I have to our public health system in Hawaii. I worked in academic services and community development. I've always been a community health worker, I just didn't know that's what it was called. To me, I was just solving problems for my community. Well, I work every day with stakeholders to learn about what the community is experiencing and how policies and laws affect them, and try to work with the leadership to change policies to make it more accessible for community. Definitely bringing resources to the community that don't have a lot of food or transportation, healthcare. Total health is what we're looking at as community health workers. We learn from providers how to educate our own communities. They're more willing to listen to people who look like them, who come from their own neighborhoods. So we are learning what our providers know to bring to our communities and make it more accessible that way.
And to our final honoree of this category, congratulations to Kamali Tripp Harris, Health Equity Consultant with the University of Utah and Community Health Worker with the Department of Family and Preventative Medicine and Spencer Fox Eccles School of Medicine. All right, let's give another round of hands to our community outreach honorees. We are pleased to recognize our next honoree in the Corporate Initiatives category. Please turn your attention to the video screens to learn a little more.
I began working as my children went back to school to find a career. And I was able to find a company by the name of IHC Health Plans. And I actually started there right around the first time the individual plans were offered in the market through Select Health. And so I got to learn a ton by being involved in that individual health plan and really helping people navigate the healthcare universe at the time and staying covered. One thing I'm most proud of is being part of a team at Select Health who truly cares about what they do and has the freedom to go out within the community and serve. There were a couple of moments in my career that were absolutely transformative. The first one was when ACA, the Affordable Care Act, became law. We immediately found out that it's complicated, and we were able to learn and adjust and adapt, and then go out in the community to help people understand exactly how to navigate what's complexity about the Affordable Care Act. Now, more recently, we've had a big change in the state with people being redetermined for Medicaid. And again, that same population needed help And our team was able to go out, help them understand, and get a lot of folks enrolled in coverage that really fits them and could be even free.
Congratulations to Heidi Castaneda, Assistant Vice President of Small Employer and Individual Products with Select Health. Okay, moving on to our next category, our dedicated healthcare educators. Please again take a look at the video screens.
In my role as a clinical transformation advisor, I work directly with providers in helping them to improve their quality and also working with them with members that maybe have greater needs. They are maybe sicker patients or people that are frequenting the ER, things like that. Providers and members sometimes kind of get lost in the shuffle. Providers are really busy and their focus is and should be on the member. That's where they should be, is with their patients. And what I do assists them. I kind of take some of that burden off of their shoulders in being able to focus back on the patient by providing them with information or work processes or workflows or things like that they don't have to stop and do themselves. They can just plug and play, and then they can really focus on their members. Something that makes me feel really proud of what I've been able to do is the relationships that I've been able to develop with the providers. In doing that, they know that they can reach out to me and they can trust that I'm going to get back to them in a timely manner. And then with that collaboration, being able to really affect the member at a level that's really important.
Please give a warm welcome to Cheryl Carter, Clinical Transformation Advisor with Regents Blue Cross Blue Shield of Utah.
I started out really focused very heavily on laboratory-based work, looking at how stress affects our health, how our relationships can help us cope with stress or even be sources of stress, and the recognition that our relationships impact so much more of our health beyond the scope of stress. That in turn led me to identify social connection as a significant and independent protective factor, and isolation and loneliness as independent risk factors for earlier death. It's been gratifying to see the kinds of impacts that my work has had, from recognition of this as an important issue that is now being implemented in clinical settings with the implementation of assessment in the electronic health records, to the recent work that I helped lead with the Surgeon General's advisory on social isolation and loneliness. I've been grateful to see the kinds of impact that it has already had, and I'm looking forward to the kinds of impacts that it may spur in others and around the world.
Please welcome to the stage Professor at Brigham Young University, Julianne Holt-Lundstad.
I got into nursing as a second degree. First degree was zoology, second degree was trying to combine more of the human relations side with medicine, and it was a good fit. So I was a nurse for about 10 years and then went into education for about 10 years. One of the beautiful things about education, for nurses at least, is that it allows us to use our clinical reasoning, our clinical experiences, and bring those in for the students. So having had a background already in clinical experiences, I was able to bring that right into the classroom, and it's been wonderful for both me and for the students. The thing I love most about being an educator is taking those brand new nurses and getting them prepared to go out into practice. And since the pandemic, it's been a little bit rough in healthcare, as I'm sure you have heard or seen. As we've hit that rough patch in healthcare, knowing that we have a fresh batch of nurses ready to come into the field actually helps prepare all of us for the future that we just don't know is coming. So when they're practicing, I know that me or my family will be safe, will be prepared to step into healthcare situations because we've got nurses waiting for us, and I'm helping to train those. My hopes for the future of healthcare in Utah is that everyone will get the care that they need at the time that they need it. So being able to bring those resources to individuals who struggle to get them and present them in a way that those individuals can receive them is really my hope for the future of Utah.
A big congratulations to Francine Bench Jensen, Associate Professor of Nursing with Utah Valley University Department of Nursing.
One of the big things is we keep asking caregivers to do more with less. We ask them to add things to their workflow without ever really taking things away from their workflow, and so that's problematic. How do we improve care without just adding more to caregivers, in which case how are they even supposed to be adherent to all the best practices if we just keep adding things? And so something that was innovative that we did is we looked at the data that we already had to collect. We weren't doing anything with those. We were just reporting them to Medicare and Medicaid. And so we looked at, are these associated with falls? And so we found that they were, and we created our own outcome measure to identify fall risk. And what's important about that is we already know, the things that people need to stay safe. We already know that they need equipment, right? Whether if they need lift equipment because they can't get out of bed on their own, or they need assistance, or but what we needed to do is to identify who needs what. And so the innovative part was just using data that we already had. We're not asking caregivers to necessarily do more, we're just asking them to align their interventions with the risks that people had.
Please give a warm welcome to Jonathan Wright, Assistant Professor at Rocky Mountain University. All right, one more round of applause for that category. Next, we're going to find out a little more about our honorees in the healthcare practitioners category. So please look at the video screens.
Most of my family is strictly business, real estate marketing. I was the first to kind of find a path in healthcare. And just early on, even in high school, I knew I wanted to do something that I could use my hands for and help people with. And I just kind of landed on dentistry very, very early. And what I found was there was something really cool about dentistry right when I kind of started shadowing was you can immediately get somebody out of pain. Whereas a lot of other healthcare industries, it's more of a prescription or a wait and see, or you got to take an image, this, that, and the other. Dentistry, you can help somebody pretty immediately and see the results pretty quickly. I went from shadowing a general dentist to applying for a job as a pediatric dental assistant in Cedar City and instantly fell in love with dentistry with kids. They're fun, they're loud, you get to dress a little more crazy, and they appreciate it. They're not so scared when the mood's light, and that fit kind of my personality. And those experiences, along with dental school and residency and all the things, led me to opening a spot that is very kid-focused, but parent-focused, but environment-focused. I'm definitely focused, as a provider on the outcome and trying to heal and cure and prevent disease. But my space, every single detail from the smell to the look to the feel is focused on kind of calming the nerves of kids and parents. And I think the environment is just as important as the outcome. And so that's something I focus on.
Please welcome to the stage pediatric dentist with Happy Tooth Pediatric Dentistry, Dr. Tyler Hanks.
I love helping people. That's the part of nursing that I love. I love to just sit with people and be there with them in their darkest times and in their most difficult times, and just listen. And that's what I love about SANE, is I can be a little part of someone's healing and taking back control in their life. When I was a little girl, I really loved healthcare, and I thought I wanted to be a doctor, but I spent a lot of time with my grandpa in the hospital. I was the youngest child, and I just hung out with my mom, and she spent a lot of time with him there. And I watched the doctors and the nurses, and I thought the doctors were great. They'd come in and give their orders and see my grandpa for like 2 minutes, but the nurses were the ones that were there day in and day out, and with him really having direct patient care. And I loved that, so I knew I wanted to be a nurse. I think I'm most proud of the fact that I am there for each individual. This isn't a job for me. This is a passion, and I can make a difference, and I love that.
Unfortunately, Kathy could not be with us today to celebrate, so let's just give her one more round of applause for her hard work. Now we have one more honoree in this category that we want to highlight, so take a look at the video.
We're unique in a lot of ways. So we're wellness focused, with a focus in, and especially expanding into the integrated medicine field. We are private practice, but we do all of the most complex reconstruction, and I think we are really driven by our reconstruction aspect. We love our breast cancer patients, which is our primary focus as far as reconstruction is concerned, but I also do all kinds of different types of surgeries. So I reconstruct and salvage limbs. I do a little bit of the wound care down in Utah County, and I'm the only microsurgeon in Utah County, and so we get to have a lot of fun and take on cases that would normally not be able to be cared for or treated down in our particular neck of the woods. But I think the other thing that makes us really unique is how driven we are by our patients' well-being and their overall care. We take it very personally. We take complications very personally. We take happiness and gratitude very personally, and we take dissatisfaction very personally. And I think it makes us unique because we're so invested in not just creating a positive experience through your surgical process and journey, but hopefully helping you to find ways to transition into making a better and more vibrant life, helping you to achieve life goals, not just changing your body or restoring your body. So we love it. We are very passionate about it.
Congratulations to Elise Meekum, reconstructive and cosmetic microsurgeon and owner of Real You Plastic Surgery and Wellness. Okay, we are moving on to our next group that have shown immense compassion by developing programs that deliver the best possible care and support for patients and for their families. So take a look at the video screens for our Healthcare Innovation Award winners.
About 10 years ago, I was watching my second oldest, and he was playing a multiplayer gaming system, so he had 3 screens going there. He was working on a final thesis for his college class and FaceTiming a friend 2 states away. I was supposed to go get him for dinner that night, and I'm watching him as he's got his headphones on because he didn't hear me calling him, and I'm like, we have got to change the way we teach these kids, because if we don't, they're going to be so bored out of their mind. My concept that I've been working on for a long time had been a medical school with no scheduled classes, with no large classrooms, with pre-recorded content. We have 2 of our own recording studios, and then students watch it in small learning pods or in groups. So our building has 70 living rooms that the students accomplish the material in. They don't go into a big classroom and sit down and watch somebody up on front, the sage on the stage, dictate to them. So it's interactive, it's engaging, and the students really seem to like this. We have over 3,200 applications for our class, and right now we're moving into a brand new building that has all of these concepts and designs integrated into the building, so the building and the curriculum are hand in glove. That's why I came. Nobody gets to do this. This is a once in 10 lifetime chance, not just a once in a lifetime chance.
Please welcome the founding dean and chief academic officer at Norda College of Osteopathic Medicine, Dr. John Daughtry.
I don't know if I ever really thought I wanted to get into healthcare. When I launched my first company in 2003, it was a company called Magellan. We were a human capital management firm. So we managed a menu of business services, right? So we did everything from legal to payroll and employee benefits. In fact, in the Western states, our largest division was employee benefits. And the Western states are very unique markets in terms of healthcare, right? They're very regional. You tend to develop very personal relationships. So as my human capital management firm grew, and as these benefit clients throughout Utah and other states grew, I just sort of got sucked into the healthcare world. And it's interesting to look at from the business side of healthcare, from about 2010 when the Affordable Care Act was passed to today, and to see the consequences of federal regulation in a shifting marketplace. And so as we looked at what was happening in healthcare, not so much from a care delivery perspective, but from a business perspective, from a transaction perspective, you could see that the need just continued to grow to create a better experience in healthcare. And so that's what led from exiting and selling Magellan and launching this current venture, Savos.
Big congratulations to the Chief Executive Officer of Savos Health, Lucien Morin.
I always knew I was going to go in healthcare, even as a really young person. I had the opportunity to have family members who needed help early on, and I just loved it. And so the very first thing I did when I could was I became a candy striper, which is really funny now. I really did wear the striped outfit. And I worked at a candy striper for like 6 years, and I just started working in nursing homes and doing those things. So to me, you know, it's just something that I innately knew because I love trying to work with people and give them the help that they need. One of the things I'm most proud of really is the impact on individuals and impacting their lives and for the better. And you know, one particular project that I was involved in a few years ago and have been involved in since, but is improving sepsis care. And the idea of being able to save people's lives and think about people who were fishing with their granddaughters or doing something fun is really impactful to me, and that's really the most important thing to me.
Please welcome Holly Rimash, Chief Clinical Officer and Senior Vice President for Health Catalyst.
I started out as a pharmacy technician, and I loved pharmacy altogether. And I love that we could help people in different settings. And there's not just one setting of pharmacy, not just retail setting, but there's hospital and lots of different areas. So, and I found myself in home care, which I really love. In my role, I oversee an infusion pharmacy and manage quite a few staff, but our goal is really to give patients care where they want care. And a lot of times this is in the home. COVID pushed us everything to the home, and we are now kind of the forefront and center in healthcare. So we work to push programs into the home, push medications into the home, do things that you never thought possible in the home. Our current programs are hospital in the home, as well as chemotherapy in the home. I think my favorite part of my job is that I just make a difference. Our patients really oftentimes are very sick and have a hard time getting to the hospital, getting to a clinic, and being able to provide antibiotics or TPN or therapy in the home really makes a difference in their lives, and they can get the same care that they would get at a hospital setting.
A big round of applause for the Clinical Pharmacy Manager at Intermountain Home Care and Hospice, Elisa Thomas. Okay, we only have one honoree for our next category, volunteer. So take a look.
That's one of the things I'm really passionate about is volunteering. And
Like, I volunteered with the Red Cross for 20 years delivering blood. You always hear about the Red Cross when something has happened. And so it was after the tsunami in 2004, and I kind of had this thought in my mind, like, I hate waiting for something terrible to happen. And so you just kind of think of the Red Cross when you think of disaster relief. So I went there, I said, there's got to be something I could do proactively. And I went there and looked for volunteer opportunities, and they have a lot of them. Well, I think also volunteering in healthcare particularly is very important, because that's one of those fundamental ways that you help bridge that gap for providing services, especially where they're so specialized. I was fortunate, I just drive blood from point A to point B, but there's clinics that provide services to low-income communities and things like, and these PAs and these nurse practitioners we worked with went to the Indian Health Reservation, and they gave their time to do that. And so volunteering, I think, is a fundamental element, especially with healthcare, because it is specialized. Not anybody can just go in and give you a physical or diagnose what's wrong. And so to be able to have healthcare providers who do that is absolutely necessary.
A big congratulations to Optum Utah's contract management expert, Kenneth Kuhn. Our final category for the afternoon will recognize our Lifetime Achievement honorees. So please take a look at your video screens.
Well, I've always liked and had a passion for health and wellness. And sometimes as humans, we fall off the rails. And when that happens, you need a little help. And that's what the intensive care nurse does, is she helps you get through these bad times. My favorite part of the job is that I get to meet people and I get to interact with them, maybe just for a short period of time, but it does give me the ability to make a difference in their life, and I really enjoy that. I feel that the universe has granted me that opportunity to help people when they need the help the most. And I think that's what I really enjoy about going to work, is that I can make a difference. The future of healthcare is kind of nebulous right now. I feel that there's so many nurses that are leaving the bedside that we need to keep them at the bedside, and they've got to make it better for the nurse, I think, at the bedside, because people are burning out they're just burning out by the tons. And the other thing that I've noticed since when I started is you spent more time at the bedside with the patients, and now you spend a lot of time, as one of the doctors I used to work with said, the nurses spend more time nursing the computer than they do taking care of a patient. So if I could change anything, it would be somehow have AI do the charting so that you don't have to waste your time doing all that.
Unfortunately, Pamela could not be here today, but to accept the award on her behalf is her daughter, Megan Corrant Langford.
In June, I left Select Health after almost 25 years and started my own consulting company where I'm helping other healthcare leaders navigate the legislative and regulatory environment in Utah. I started my government work as a Hinckley intern my senior year of college. I absolutely loved being on the Hill And the legislator that I served with was Representative Judy Buffmeyer, and she was actually running a bill called catastrophic mental health coverage. That really led me into an interest in healthcare as well as politics, and took a job. At that time it was IHC Health Plans. It's been renamed to Select Health, but back then it was IHC Health Plans. So started there 25 years ago in compliance and regulatory environment, and they were just getting started in government relations. So it was just a perfect way to start. Actually developed their government relations program at Select Health, and I've been the only government relations person they've had. So it was really nice to get that started and build the processes and build the relationships for the company. So it was a great 25 years. So the benefit of serving in government relations at Select Health for 25 years is that now I can take those relationships and that very deep technical knowledge of the healthcare industry in the state of Utah, the relationships with our policymakers and regulators, and help others as they navigate the process.
Please welcome our final honoree of the afternoon, Elena White, consultant at Elena White Consulting. All right, let's give another round of applause. Congratulations to all of those who were honored this afternoon. I have to tell you that I feel like the past year I've been, well, let's just say I have 3 little kids, and we not only hit our deductible this year, but we hit our out-of-pocket max. So I feel like I joked with the ER doctor, we went in for my son, and then a few weeks later we went in with my other son, and I was hoping it wasn't the same ER doctor, and it was when he came in the room, and I joked that I needed a punch card. But it goes without saying that the past several years, I think people have realized just how much they need and appreciate you healthcare heroes. And I love that we say heroes, because that's truly what you are. And I have spoken at a lot of these different, business functions, and I would say this is probably the first time that I teared up watching several of those speeches on the video, whether it's the maternal medicine that hits close to home, or talking about children, or just the fact that I can't think of another career where you truly do impact people's lives and their families and their children, and it happens on a daily basis, and that's pretty amazing to see, and just the dedication and the passion that came through as each of you talked about your different experiences and how you came to whatever profession or whatever area of medicine that you are in. So thank you so much for letting me spend the afternoon with you. And we do have just a couple of housekeeping items to talk about. You may have noticed there is a QR code, a little tent in the center of your table. And as a thank you for coming today, Utah Business will offer you a complimentary year subscription to their monthly publication, so you can just scan the QR code and it will help you get signed up for that and complete the registration. And remember, your parking is paid for, so if you haven't got that voucher when you checked in, make sure you check with the table in the back as you're heading out, and you can get the voucher that you need as you leave. Now, we do recycle all of our name badges as well, so if you can just set them right on your table. We do a lot of these events, so we can just use those, or if you still have them, you can also drop them off at the registration table as you leave, but that would be very much appreciated. And we do want to thank you so much to the Grand America and for their amazing staff in serving us this afternoon, the amazing lunch. We truly, truly appreciate them. And once again, thank you so much for coming this afternoon, and congratulations to the 2023 Healthcare Heroes.